Welcome to Dementia-Friendly Prince George's County, Maryland, North 3rd Sector webinar series for caregivers. Today's topic is Depression versus the Blues for Caregivers, sponsored by Prince George's County Government and the Department of Family Services.
I want to say thank you to Catherine and the Dementia Friendly America group for inviting me tonight. I was with them in the fall for another presentation, so it's nice to be back, even though we're not back in person. As Catherine said, I am the Assistant Director of Seabury's Care Management Program. Seabury Care Management has been around for about 26 years, and our role is really to provide guidance and education and work individually with families to help provide a plan for aging. But today I'm here to talk to you about depression versus the blues for caregivers, and also to talk a little bit about how COVID has impacted this with the pandemic. As Catherine said, please feel free to type in your questions. In person, I tend to be a lot more interactive, so I'm going to turn off my camera so you won't see me wildly gesticulating with my hands to my living room here. But we'll get started. Please feel free to participate as much as possible. Thank you. So, one of the first things that I do want you all to respond to is just, are emotions normal? And you see the fun little characters beside at the side on the, I guess, the left-hand side of the screen here. What are some of the emotions you see there? Anybody have any comments? And are emotions normal? So the answer is, of course, that emotions are normal. All of us experience a broad array of emotions throughout the day. In fact, I was just telling Catherine earlier, I have two little ones at home, and one of them is 3, and he's learning how to express himself. Mommy, I'm sad today. So from the youngest age, we do express these emotions. And the reason why I kind of take that step back and acknowledge the emotions that we have is because one of those emotions is sadness. And sadness is not equal to depression. It's a normal human emotion. We all experience it. We all feel blue. Depression goes a little bit beyond that, especially when we're talking about major depression, and especially with caregivers and older adults. The symptoms of depression really do cause significant distress or impairment in our day-to-day functioning. I'll go into some of the signs and symptoms a little bit later, but that disturbance in functioning is not something that's caused by a general medical condition. It's not something that's caused by a substance, the effects of a substance, whether it's medications or alcohol. On the other hand, people do sometimes use those things to try and treat depression. And then the other thing that depression is not, or excuse me, sadness, depression is not accounted for if there's bereavement. So depression is not a normal thing, but it is treatable, and that's very important. So when we look at caregiving and depression, there's a lot of statistics out there, especially with the National Alliance of Caregiving. Family caregivers who are providing 36 hours or more of care are per week are more likely to suffer depression. In this time of COVID, of course, that has increased exponentially. We've had some of our clients' families who have moved their loved ones back into their home. We've had adult daycare programs shutting down. These are not things that, I'm not telling you things that you don't know or that you haven't experienced, but just to normalize it all. So a family caregiver who perhaps was just providing, they've got a break every couple days because of adult daycare, or perhaps they had a caregiver coming in and now have decided that the risk there is really too great for their loved one and their family. As you'll see on the screen, spousal caregivers are 6 times as likely than another family caregiver to suffer from depression. Children are twice as likely, and we already know that women tend to suffer depression at a greater rate than men in general. Some of the other pieces that COVID has kind of brought into this and complicated the matter a bit is that we no longer have some of those in-person supports that we've had before. Human beings are really set up to connect with other people. We find a way no matter what. I have lots of clients and caregivers who say, well, dad is a loner. He never talks to anyone. But you know what? That human interconnection really surpasses all of that. Even if dad is a loner, he still craves some of that attention every once in a while. Also, the fact that we're now concerned about touching one another. Especially, we've seen the pictures of the grandparents who come visit. I think, was it on my Facebook feed? There was somebody who had created a big grandparent hugger, and it was this huge piece of plastic that saran wrap that they had set up, and the grandparents came and they got to stand in the plastic and hug their children, their grandchildren, because we really do crave that touch. Sometimes you can calm somebody down just by that touch. The increasing worry and decision-making angst that's been involved with COVID, I feel like every decision that we make throughout the day is complicated by what is the risk involved here. I have to go out to the grocery store to find that toilet paper, which thankfully we're able to find a little bit more now. But even, in fact, today I had to go to the doctor this morning just for a brief check-in. And I swear I must have walked to the front door 3 or 4 times as I thought, I better bring the gloves just in case. I better bring an extra mask just in case. Do I have my hand sanitizer in my purse? And it's not like I don't have these things right there. It's just that I don't go out. So I really have to think about it now. I have to consider what I'm doing. And you know what I did while I was there? I have to bring a family member to that same doctor's office in a week or 2, a different location in that doctor's office. But what did I do? I spent the extra 10 minutes walking to the other specialist's place, or the lab work place actually, to see what the setup was like, so that I could say, okay, well, at 8 o'clock in the morning, this is what it looks like. So that's when I want to bring my person in here. And I see how they've got it set up now. I've gone through it once, so now I can bring my person back in here. Increasing financial concerns. We don't know what's happening. We're not feeling very stable or confident in things. All of this is kind of wrapping up and increasing our anxiety and our worry and adding into the depression or to the sadness that might lead to the depression. Some of the risk factors with caregivers have to do, I separated it into two different sections because I thought it was easier to break it down that way. I feel like the first set is really what is the situation, and some of this we discussed a bit earlier, but how many hours of care is the caregiver providing? What's the length of time? What are the behaviors of the care receiver? And again, you know, one of the things with emotions are that we also feed into one another's emotions, and that is especially true if someone is suffering from some sort of dementia. These emotions that I talked about at the beginning, and I mentioned my little one, and I apologize for the phone behind me. They start right when we're born. And the first thing that we do as a baby is look to our parents to help us regulate that emotion. We reflect the emotion that we see from our parents. And I bring that up because when you move into having something like dementia, that is a basic thing that remains, and that reflection also remains. So one of the examples I use, which is very easy, I think, for all of us who have been parents to visualize, is that young child, you know, right around age 1, who's learning how to walk and falls and bumps themselves. And it's a little bit of a scary fall. The first thing that they do is they turn and they look to their parent, especially if it's one, you know, again, they're not really hurt that bad, they just were startled. They turn and they look to their parent for reaction, or whoever their caretaker is. And if that caretaker does a sharp intake of breath and gets a scared look on their face, that child immediately bursts into tears. Whereas if the parent is calm and engaging, it usually calms the child right away. And you can see this too reflected in some of our clients who have dementia as well. If we walk into the situation as a caregiver with angst and anxiety, that immediately reverberates in between the two of us. And suddenly some of those behaviors, those problematic behaviors, those challenging behaviors increase tenfold. But how do you stop that when you've got the news coming in of what's the latest thing we know about COVID? Not just even the normal everyday things, but now you have the pandemic on top of it. So those behaviors frequently do increase. The ability of the care receiver. How much assistance do they need with what we call their activities of daily living? So bathing, dressing. Do they need reminders for every step, or does someone just need to lay out their clothes? That's a lot less responsibility and time. And it also, there's a certain, how do you fit the dignity and worth of the person you're caring for into that piece. The other piece, of course, is caregivers. When you look at the statistics for caregiving, we have many caregivers who are over the age of 65. And of course, those who are 65 through 90 are at the highest risk for suffering from depression. the cognitive impairments of the care receiver, which we sort of already spoke about back there with the behavior, because those two tend to be tied together, although not often. It could be that there's another medical condition. It could be that somebody's in so much pain that the behavior is also challenging. The environment is a big factor. Being able to get out, being able to walk around is huge. And of course, having to stay in place puts an extra layer of pressure on there. Okay. The other piece of it, of course, is what's going on with the caregiver themselves. There can be, I should say, a genetic component to depression, major depression. Medical illnesses can also be correlated to depression. Things like heart disease, diabetes, Parkinson's, physical disabilities, all of these things can add to the risk factors. Reduced sense of purpose. For some caregiving, I find there are some people who are thrown into it. They never expected to be there. I know there's a lot of individuals during this pandemic who they decided to move their parents home. They felt like that was the decision, the best decision for their family. For some of those people, it was probably not even on their radar. So in some ways, this has been forced upon them. And it's something, you know, some people do it willingly, some people don't. But those people who take them in are willing to do it. That's not the issue. But now they aren't able to do what they were doing before. So for some of those people, there is a reduced sense of purpose. So how do we find that purpose again? How do we connect? Of course, substance abuse is always a risk factor in these types of situations. Some people find it easy to turn to alcohol just to say, you know, I just need a drink at the end of the day. Well, actually, it turns out alcohol is a depressant. So it might make us feel better in the short term, but in the long term, it has some compounding impacts. Inadequate social support. Frequently, what we find is caregivers do end up feeling like their world is not quite as big as it used to be. They have a different responsibility that they need to pay attention to now. And certainly with COVID having impacted some of this and also closed off our ability to, you know, go to our book clubs, go have a cup of coffee, go take a walk with a girlfriend, go play golf with the guys, or whatever it is that we do, where go to the baseball game. We can't do those things right now. Illness and isolation, of course, we've already talked about that. Medication interaction, that is a big thing to talk to a doctor about whenever a new medication is prescribed. How is this going to impact me? How does it match with the other prescriptions that I'm already taking? And, you know, whenever I give a talk and it has this piece about talking with your doctor about the medications, I'm always happy because most of the participants, that's something that they always do. They always take their prescriptions into the doctor's office and the doctor checks them. By the same token, we need to be checking the doctor as well. Just because he or she is checking it off on the list doesn't mean it's digging down into that deep question. You know, what are the side effects of this? does it interact? Does it impact? I've only been at the doctor twice where they've actually spent a lot of time talking about that without being asked. Usually it's kind of just the checkoffs. Anxiety and fear also add into these risk factors. And of course, right now we have plenty of those. Recent losses add to this as well. You know, just because you're caregiving for a parent or a loved one doesn't mean that life has stopped around us. Things are going on. I also say loss isn't just about bereavement or the passing of a good friend or another family member. Losses can really be anything. Consider when a spouse is taking care of a spouse. The couple is aging together. They're not aging at the same rate or speed. They each have their own concerns. But even if I'm the caregiver caring for my husband who has dementia, let's say, if I'm unable to do something any longer, or I'm starting to feel like I need to use a walker, or I need to do something differently than I used to do, that's impactful. And that's something that I need to take time to grieve. But again, where do you find that time? It is something you have to do for yourself and the person that you're taking care of. And I emphasize that because one of the unfortunate things that we see is that frequently caregivers may pass away before the person they are caregiving for. The statistic on that is about 63% of caregivers who are 66 to 96, that age range that I gave you before, have a 63% higher mortality rate than non-caregivers. So this is certainly something that we have seen frequently. In fact, I was just telling Catherine before we started this webinar, we had a client who we did end up, it was a couple who were living together in their home. And the reason why we came on board was because they didn't have any family in the area, and the primary caregiver realized, actually he didn't realize, his neighbors and extended family realized that he really wasn't able to take care of himself or his husband any longer. And so we got them settled, and indeed he ended up passing away before his loved one did. But fortunately it was after we did get him the assistance and the help he needed. So he had a good year or two before that happened. So some of the signs and symptoms of depression, again, when we're looking at symptoms are the things that we notice about ourselves, and signs are more the medical piece that the medical professionals would notice or infer from the symptoms that we are showing. So being impatient or irritable or anxious, we tend to think of depression as being the blues, you know, crying, being upset or just downhearted. And in fact, there are other ranges of emotion within depression, and sometimes that depression manifests itself as being irritable or impatient. So getting angry about things that never would have upset us before. Usually we're an incredibly patient individual, and suddenly we're lashing out because the shoe wasn't put back in the right spot. Little things like that. and actually being susceptible to things like colds and flu. Getting sick frequently may be a sign or a symptom. Difficulty, of course, focusing or remembering or making decisions. And, you know, who hasn't had some of that during this period? I'll be the first to admit it. It's just, it can be tough. Just juggling all these balls. And one of the things that depression can do is make it more difficult for us to remember things. So, and then of course there are the symptoms that we tend to think about. Things like having less energy, being that just mind-numbing, bone-draining exhaustion, very lethargic, fatigued with a loss of interest in anything. And when I say loss of interest or loss of pleasure, this is when you start doing something that normally makes you happy and it's just not doing it for you anymore. It's not, and again, this is not, you know, today, the thing that makes me happy isn't making me happy, but tomorrow it does make me happy. This is kind of ongoing and sustained or very regular that it happens more often than not. Withdrawing socially and neglecting our needs. So, you know, we've heard the situations where, well, talk about COVID period. I don't know about all of you, but I got dressed just for that. Well, not dressed just for this, but I put on my nice work shirt just for this program today. Before that, I was in my sweatpants and sweatshirt, and I apologize again for the little one upstairs. But it's not making that effort. And of course, during this period, all of us are probably a lot more lax in what we do and how we dress ourselves. But when we're talking about depression, this is that I'm not even putting on my nice shirt to do this presentation for you. I'm not putting the effort into it. Sleep disturbance, and it's interesting with depression because I feel like depression has so many of a double-edged sword. So the reason why we say sleep disturbances is because in some people it may manifest as not being able to get to sleep, the insomnia. For other people, it may be more that they're sleeping too much. They just can't seem to wake themselves up. Or get out there and be active, or do anything really besides not even get out of bed. Eating more or less than normal. I think many of women of my age will tell you that, you know, the chocolate is definitely where I head for. My husband heads for the ice cream when he's had a bad day. Actually, he heads for the ice cream anyways. But for other people, it's really not eating at all. So it could be both. And again, my husband and I are fine, but just as an example, I know we can all relate to. Feeling hopeless or helpless that there isn't a way out. And of course, the thoughts of death or suicide are when this has really reached a point of extreme concern. And in fact, I put this slide in there because I do want to emphasize suicide and just the life-threatening potential it has. If you know somebody who you feel like you have concerns about, ask the question, find out what's going on. Again, it's not, what you need to do is get help for them. But if we don't ever ask the question, then we won't ever know what we're dealing with. Obviously, this is something that needs 911 or the emergency room and a professional. But certainly always, offer your support. The way we do that is by listening without judgment, without saying, just pull yourselves up by your bootstraps, really, really listening to it and taking it seriously. And don't ever say that you won't tell somebody, because this is serious business here. So, but as I said, the positive thing is that depression is treatable. Many people do respond well to treatment, and in fact, older adults are one of the best responding, best groups that respond to treatment. So that caregiving group that might be in between 65 and 96 or even older really do respond to the help that they receive. It's always important to talk with your doctor. And now Medicare has certainly made, and other insurances as well, have made it easier to access telehealth, at least for the current moment. Certainly a mental health professional is the other way to go. Again, you never know. One of the reasons why we talk about seeing a regular doctor as well is because you never know what might be going on with a medical illness that you have, or the method that they're using to treat that, the medication. Are one of those two things actually impacting you in a way that's unexpected, or impacting an illness that you have and adding to this depression or making you susceptible to that? So is there a way to overcome that? I know at times when I've brought up medication to people, it's not something that they want to do. But keep in mind that medication might just be the bump you need to get out of this. And then you go on. But sometimes we all need that little kick in the pants in order to help us move on to the next step. Different types of therapy are out there, and they do work. You sometimes just have to find the person that works well for you, as well as the type of therapy. Is cognitive behavioral therapy what works best for you? Is it really problem-solving therapy? Or interpersonal psychotherapy, or reminiscence groups? What is it that works for you? The other thing is that really combining this with complementary or alternative therapies, whether you look at something like acupuncture, whether you look at another type, yoga, anything like that, and I wouldn't call that an alternative therapy, but this isn't just a one thing, one and done. And I liked that picture of kind of the body, spirit, and mind piece, because it is really about you as a whole picture when we're trying to treat depression. It's not just about one piece. If you fix kind of the medical piece of it, but you're not fixing the spiritual piece of it, or the mind piece of it, or the emotional piece of it, then it's not going to work or be sustainable. So what can we do as far as self-care to avoid depression? And certainly, if there's anything in the chat box, or if you want to put anything in the chat box about the ways that you provide self-care to yourself, I think that's a great thing to share. So one of the things that we always talk about is to create a team and have a plan. What is it that you can control, even in this pandemic time? Where do you find the control? Because that's a lot of what we're all fighting for, right? What is it that I can do? Because I can't do it all. Accepting that you can't do it all and asking for that help. I think that's been a positive thing of the COVID, is that we have been able to accept that we need a little bit more help. You know, I think all of us are really looking to, okay, at the beginning we were kind of looking to, well, where do I find that toilet paper that I need? How do I keep my family safe and not have to make as many trips to the grocery store? And for our clients, it was often turning to other family members, turning to the gig workers who are out there, any of that type of thing. You can tell very much that my boys did not get their naps today. The other thing is making sure that you get yourself out as much as possible, making sure that you are exercising, finding that space for yourself. I know if someone has moved in with you, it may be that what you want to do is create that separate time, and figure out how do I do that. It's a little bit harder if you have somebody who constantly is following you around, but is there a way to kind of set that up? How do we socialize in the midst of COVID? Looking at the Zoom calls, now that we're kind of opening up a bit, is there a way that we can incorporate that in there and still remain safe? And again, a lot of this is also knowing what you need and what your care receiver needs. Improving our diet, establishing a healthy sleep schedule. I know for myself, if I don't get the amount of sleep I need, that is, the next day is always worse than it was today. So whatever it is that is going to keep me up to midnight, it really is almost never worth it in my life. I know I have plenty of friends who are able to do that, but that's just not something that I can do. And I know that about myself, so I do it. I already talked a little bit about alcohol and its negative impacts, but also the caffeine can make us much more anxious and jittery. And of course, smoking is never something that we want to start. Taking care of something like a pet can be very rewarding. It gets you out of the house. They often love you without reservation, and they don't need very much in return. Again, volunteering may not be something that you can do right now because of the circumstances. But on the other hand, there may be a way to volunteer. Certainly doing something like learning a new skill, taking on a new activity from afar. Maybe now's the chance to look into something like a book club. Something that you can do that helps you to engage, but also adds back into that whole idea of self-worth. How do we incorporate that in? Support groups are a great resource. That is when we learn from one another, and I'm a big believer in learning from one another. Frequently in my presentations, we're doing a lot of communicating because I feel like I'm bringing one perspective, but there's a whole group of us here who are bringing in our own perspectives and can share kind of some of the ways that we've overcome this. Okay. And I did want to go into the planning just a little bit more because I do feel like this is such an important piece. Underneath the creating a team, the first two, family and friends and professionals, when you start to create your team, it's really about understanding who is around you and be creative with it. You know, if your next door neighbor has asked if they can take out your garbage forever, now is the time to let them go ahead and take out the garbage. In fact, I have one of my clients who said, you know, she's very much, they very much need their neighbor's assistance. And so now she gets the garbage ready for him every Tuesday to take it outside for her. She could probably struggle through it and do it herself, but this is something that gives him a feeling of worth. And now she has a minute to kind of relax and recoup before the next phase of caregiving for her starts. So that's great. Even if it's something small, what can you kind of divvy out to other people, relinquishing some of that control? One of the things I hear frequently from caregivers is that the care receiver wouldn't accept something from somebody else. But I would encourage you to kind of try it and see. You never know what will happen. And in many cases, you know, the worst case is, well, we just try something else another day. For people who are caring for somebody with dementia, one of the blessings of dementia is there is a bit of a reset mode. If something doesn't work the first time, we walk away from it and we try a different approach the next time. We see what happens. Again, that's a little bit later in dementia, but I have seen that work very well, the distraction or the redirection. How can you expand that caregiving team during COVID? I know when all of this started, all of us contracted down to our little units. We're now being able to branch out a little bit, but honestly, I still don't even want to be out there and about unnecessarily. And I am not telling my clients or my parents to be out and about. But there is a little bit more breathing room now. By the same token, even in our contracted kind of phase, is there a way to expand our quote unquote pod or our bubble? You know, it doesn't just have to be limited to myself and the care receiver. Is there somebody else we can allow in there? Again, doing the vetting that we feel we need to do. Making sure, for example, even with my own parents, and accepting the amount of risk that other people are willing to take. My parents, for example, they are older adults. They do have underlying medical conditions. I do have two little ones. We just went to see them a couple weekends ago, and I went through all of kind of these questions. I was ready to spend 2 weeks in quarantine, making sure that those 2 weeks we got groceries delivered. We didn't go to our pod. We have a neighbor that we have a pod with. We were going to just sit there and kind of quarantine through it. And, but my parents actually were willing to accept the risk. They said, no, you know what, come on down. I know what you've been doing and how close in you've kept yourself, and we're okay with that amount of risk. You may not be okay with that amount of risk, but understand, well, how much risk can I take, and what is that? What is the benefit for me? Because again, if you are suffering from depression, um, you're not going to be able to take care of your care receiver as well as you would if you are your healthy self, your best self. Um, how do you use this next piece is respite care? How do you use paid caregivers? Is there a way to do it that you feel is um, what fits the needs of your care receiver and your family? How about the community support? Is there are there supports out in the community through your church, through something else? Um, is there somebody who could call and the person you're caring for would love to and has the attention span to sit and talk with them, or will something like a tablet work? Really just trying to be a little bit creative. Um, we have one client who we've ended up um, actually watching movies together. Um, and we're really not together. But instead, that that life enrichment person gets her quote unquote assignment, and she watches the old movie, and then they discuss it and they talk about their favorite parts. She also has another client that they finish a puzzle together. So you know, is there something like that that can be worked out? I've even, heard of on the other end of the spectrum, grandparents having the same book at their house so that they can read to their grandchildren. Is there a way to reach out that either the grandchildren can be entertaining, or maybe that's just your break time? Maybe you get to read to the kids. Um, so what's out there? And maybe the other piece of it is eventually, is there an opportunity to move into a community? Sometimes that is the best choice for people. It really depends upon the situation, what the needs of the client are, the financial situation, etc. Um, right now, I wouldn't be making too many recommendations on moving into facilities, but I know the places that are accepting people are doing a very good job of kind of going through these exact same processes. So is there a smaller residential community that would actually be a good fit, and does that make sense for our family? Okay. Um, the last thing I just wanted to run through quickly is just to give you some resources. Again, if you're talking suicide or crisis, there's no question about that. There's only one place to go there. The other piece is the NAMI is a great resource, as is the Family Caregiver Alliance, and Caregiver Stress by Home Instead. They have some great little kind of presentations on there, as well as informational flyers and things that are very helpful. If the person you're caring for does have some sort of dementia, whether it be Alzheimer's or not, the Alzheimer's Association is a very good resource, and I would certainly suggest taking a look there. That's also where you can find a lot of support groups and things. And a lot of the support groups out there now have really gone to virtual in order to meet the need of this crisis. So, and I do want to stop there and see if there were any questions in the chat box as we wrap up. Anything in there, Catherine?
I don't see anything, but let's give our participants a chance, and I will
Yep.
let you.
Sounds good. We've talked through a lot of information here, so don't be afraid to ask questions. I will give you my information if you think of something a little later.
I don't see anybody else typing a question. So we can move on to the next slide, Christine.
Okay.
So I just want to let everyone know about our DFA resources. If you could just go back, Christine, on the DFA resource page. We do have virtual support groups for our northern sector, caregiver support group on first and third Wednesdays at 6 to 7, and also a social distancing support group first and third Thursdays, 6 to 7. If you are a subscriber on our email list, you'll receive newsletters and other dementia-friendly updates. And then if you like to see this video or past educational videos on topics on being a dementia friend, caregiving, and more, you can visit our YouTube channel. And then for more information about the groups or anything DFA related, you can contact Sharon Johnson. Her email is also below, and that will also be sent out at the end of this presentation. Okay. We can move on to the next slide. Okay. And then for more information, just general information on aging, these are the best contact numbers. Information about community programs can also be found here. National Institutes of Health, National Institute on Aging at NIH. They also provide free resources for you to print out or even have it mailed to you. Information on clinical trials, and then also Centers for Disease Control and Prevention on aging and physical activity.
Sorry, it doesn't go right away. Nope.
Alrighty, well, thank you, Christine, again for joining us and just sharing so many strategies and just information about caregiving. We hope that we get to see you again. And
Thank you.
thank you everybody again for attending. Please continue
Thank
to
you.
monitor your email for more future events.
Thank you all. It's been a pleasure.
Alrighty, thank you everyone. Have a good night.
You too.